So a week ago, Secretary of War Pete Hegseth just announced that everyone 30 and over in the military will be tested for testosterone deficiency.
It's about time.
Right? Yeah. And then what's interesting is of course there's been a massive amount of like negative feedback from the cheap seats on this, which of course I think that they have really no idea what they're talking about. And even doctors, which has been a part of the problem for a long time.
Delusional misunderstanding.
Delusional misunderstanding. I want to open this thing with, so the CEO, Sydney Gordon. So if those that don't know, like you've been tracking this,
yep.
But like Core Medical has been working behind the scenes with Jimmy St. Clair, Chad Robichaud, and then members of Congress and members of the VA and the directors of community care to bring testosterone to the veteran populace, and something that you and I have been talking about for over a decade,
quite some time, a decade plus.
And anyways, I want to show this clip, and then get your reaction.
It's every veteran that is getting an incorrect protocol.
That is a profound statement, Mr. Gordon.
Well, I think we can, to keep it simple.
So what he just said that he's 100% that every veteran in the VA that is being treated for testosterone is getting an incorrect protocol.
We can, to keep it simple, though, the standard of care is followed from 40-year-old standards with labs that come from 40-year-old standards.
Exactly.
So what they're doing is they're asking for a very limited amount of data within your blood work that does not inform a more comprehensive care. Simply put, you get 3 markers. So it's one of them is testosterone.
The doctors are doing the best they can with what they know.
That's right.
But there's.
Are you hearing this? I am. Okay, doctor? Yes.
How do you feel about it? How do you feel about it?
So, when, again, somebody comes in to see me, I sit and I ask them what symptoms, they're having, what's going on. Then, you might, if there is a clinical practice guideline that goes along with your presumptive diagnosis, then you treat based off that clinical practice guidelines. Those clinical practice guidelines are developed by doing extensive research of the medical literature, okay? So when it comes to testosterone, you make that statement, and yet there are a multitude of reasons to potentially place somebody on testosterone. So you're making a broad statement, but when you have a patient that's sitting in front of you with their specific set of symptoms, then the physician or the provider has to make some kind of a judgment based on their knowledge, based on the practice guidelines, based on the symptoms, as to what you should order, not only in testosterone. And I hear you're saying that they just order testosterone, or they order the wrong form of testosterone. There are other
I'm impressed that he's able to sit through this guy talking. Like Sid's got to be like just chomping at the bit. Yeah, jumping at his skin to like respond.
Times, again, those are things that the physician takes into account when the patient's sitting there in front of them.
When was the last time that information was updated?
So
1985.
So again, you're making a
But the thing is that same patient comes through the door and they walk out with SSRIs and their testosterone is 250, and they say, hey, come back in 6 months, get tested again. Come back again in 6 months, get tested again. I need you below 200. How do you think the quality for that person is during that period of time? Number one. Number two, how are you going to prescribe testosterone based on one biomarker? You wouldn't prescribe any medicine for someone that has cancer based on one biomarker.
take into account what the presumptive diagnosis is, because things change in terms of your treatment protocol based on what they present with. And again, we have to deal with a very large number of people, and I understand that there are individuals who, respond a certain way, the individuals that you all see, and yet can you take the individual response and can you be sure that you can scale that up across a very...
This guy's really good at talking and saying nothing.
Typical politician.
Yeah.
Just dance around the subject and never really answer anything.
Never really answer anything. Well, it's this and that, and it's variables and
large population. And that's
large population.
where we find ourselves, and what you alluded
What about the
to,
human being?
there are millions of veterans that come through the doors all the time. And so when it comes to research, that's why we always go back. If you can go to the FDA, you can get the FDA to get those approvals through
The
large
FDA.
scale studies, so we can look at the evidence and we can say we can safely...
Wasn't the COVID vaccine approved by the FDA? I'm
It
pretty
was,
sure.
or-
I'm pretty sure it was, and then it's like killed more people than like the war.
Not in 2020, but the first full FDA approval for COVID-19 vaccine was granted on August 23rd, 2021 for the Pfizer vaccine.
People, it's like killed like more people than the war. Heart attack, and myocarditis, and whatnot. Crazy. I mean, I know somebody that had a widowmaker heart attack because he got it.
Yep.
Super fit, 50-year-old heart attack.
Everyone knows someone.
Yeah.
If not, we're
Anyways,
Lying.
so FDA is like not a, I feel like that's not a stamp that I would put on something that's like success.
And scale that across the veteran population.
And I believe there's just a quick bridge here as well that hopefully brings us all back together on this. And the first is we agree that proper research should be done. And I also believe that we do agree that the problem is the research pathway could be a bit more clear. The next piece here is we do agree there's a problem, right? There's clearly a gap, and I'm excited about hearing some of these stories here from some veterans that...
This is Jimmy St. Clair talking.
That organizations like CORE were able to help resolve. So there certainly is a gap, whether it's in access or understanding or all physicians being trained the same way, but there's a gap that has been addressed. It does seem that possibly the difference of opinion could really be in what's the proposed solution here. And my goal here would be for everybody in this room to align on, if we aren't aligned on what that solution is, that we do find a way to align together, and that may take more conversation. However, we want to be sure that doesn't take away from the fact that there certainly is a problem here to address.
Yeah, my goal is just to show the data that we have, which is in that pamphlet, and educate. I want to be your teammate 100%, but 60% of the people that we treat are veterans or active duty service members, and we've treated tens of thousands of people. And it's really difficult to hear the stories, whether they're prescribed improperly or they don't have the ability to receive the medication. We need to work together.
So we did a blind study, both on the patient pool and you and I probably, we could already tell what the data is going to be on the back end.
yeah.
But it was staggering, and that's the study that's what he was taking up there.
The information he's providing right now.
Information up there. Anyway, we really used the, you remember the anxiety and depression scale, the
Yep.
PHQ-9, GHD-7. So that's what the military and VA uses, right? It's
Yep.
the standard depression and anxiety. So we used all of that in conjunction with testosterone, and
What was the kickback on that?
the people that were not on, they had severe anxiety and severe depression, and the guys that have been treated are getting treated properly. It's like night and day. Like they have a willingness to live.
We know it from our own
Yeah.
experience.
Right. So going back on the active duty thing, then we'll get into the veteran side of things, which is what they're doing. What is your, like, there's a lot of negative talk about it. And I think that, man, at 30 years old, imagine if we were being screened for our hormones while we were on the team.
I mean, I think it's like anything else. Like, I think the basis between a lot of what they're discussing in all of this. Big pointed question. You could kind of boil it down. Again, this is just loosely listening to that. Is like, are we asking the right questions, right? And are we like getting like the proper testing? Are we asking to get the proper testing in order to be able to gain the fullest understanding of what needs to be and what ways we need to be able to move forward? It's just like anything else. Like if you had the ability to screen for cancer, would you rather find out earlier?
Right.
Or would you rather find out later?
I wish that we
like
would
stage 4 level,
right.
Or would you rather find out at stage 1 level?
I wish that we would have been getting these panels done every year with our NSW physical.
100% that should be integrated.
Should have been completely integrated in the NSW physical, because you go on deployment, something happens. Now you have an actual marker of this is what it was pre-deployment. This is what it is post-deployment.
You can input, right? Should someone fall into something where it be training or deployment or whatever, you can begin to put on that timetable as well. Like there was a blasty over here, or an explosion over here, or
right.
a bad jump over here, or
right.
a rollover, or something that's highlighted, right?
Mm-hmm.
Like within that time frame, you can begin to put little bleeps on the radar
yep.
as well, and say, okay, well, here's the marker here, the baseline, here's the baseline here. What happened in between those two dots? We have the right questions to be able to ask.
Yeah,
and we can actually pin it or have an understanding even closer to when they may have started.
Because we know that trauma, any sort of car accident, is going to mess up your endocrine system, and we see a drop in testosterone post crash. Like for instance, did you do a hormone panel post your parachute incident?
No.
So, without knowing, just knowing the history, guaranteed your endocrine system was trashed post.
Again, I don't have the clinical data as far as like numbers are considered or concerned, but I have my own human understanding and my own human data from
how you feel now versus how you felt post thing.
Yeah.
And what's sad about that is, for those guys that are living that way, and then something happens, it takes the recovery even that much harder. Because we know low T equals, like if your testosterone drops and you become less optimized, you are now having a harder time recovering. We see this in just guys that like 40-plus-year-old men who have just aged.
And it's a lot of the things we talk about already. It's going to be on the physically, mentally, and emotionally.
Yep.
Right? It's not just a singular one of those those three things. It's going to be, more than likely multiple, if not all three happening at once. Like you have the physical issues and problems that are happening, right? And then you got the mental side of the house, brain fog, cognition, thinking, like emotion, and then the emotional side of the house of, either reactions, outbursts or whatever it may be. And they don't always have to be huge and large. And I think this is something people kind of look over from time to time, is that they're always expecting it to be like the guy who's having, huge, explosive, outlandish behaviors.
Oh, roid rage.
Yeah.
That's not.
I mean, I'm talking like if there's an issue prior to having
Yeah.
like some sort of, intervention on a proper manner, right? Those things are happening.
Because you don't have a fuse. You're not.
You don't have ways to manage it.
Yeah.
You have the
that's
inability, but less tools to be able to handle certain situations.
So there's already a preservation of force issue. We already have that issue. Just wear and tear. Just the regular life of a military service member. And we don't have to talk about special operations. Just somebody in the combat arms space,
Yeah,
right?
Law enforcement's included.
Yeah, absolutely.
EMS or, whatever.
Whatever that lifestyle is, less sleep, more work, you know what I mean? And a very high tempo. And that's literally what the paper is. It's a public paper called The Operator Syndrome, and it lays it all out. But the problem with not getting tested is now we're looking at these guys, and it's like, I think about one of our raiders who got a silver star 1 month, and the next month does something stupid, valid, right?
Yeah.
All right, but then he's the worst. Now they're talking about taking his MOS away from him. He's the worst Marine ever. Like, was he?
I was at both of those.
Right.
Like, I remember this happening.
Exactly. So it's like, well, is he a hero or is he a piece of shit?
Which one is it?
Which one is it? Because yesterday he was a hero, but what they're not looking at is the multiple deployments, all of the trauma, and then like we've talked about, the bucket fills up with water, and eventually it's going to overflow. It overflowed for him, but what if this could have been managed instead of utilizing booze and all these other things to mitigate or self-medicate?
Yeah.
these emotional side of things that's going on. Escape.
Because you have an understanding, or at least an awareness, I should say. You have an awareness that something is off.
So I drink.
Right? Like something's off with me. I'm not really sure what it is. I can't put a finger on it. God, I just must be fucked up, or I'm not sure. And then you ditch off to some vice somewhere down the line. And then typically with vices, they don't get better with age.
And keep in mind, we're talking 30-year-old plus individuals. So that means they've been active in the job on an average 10 plus years, right? So we're talking about a 10 plus year military service member, special operator, who's we see at around that age, and also in law enforcement and fire service, is like that's when the break starts to happen.
Yeah, I have no numerical data on this, so don't anybody hold me to it, right? But you know, working with and around, you know, the law enforcement population, a lot of those guys tend to be somewhere in like that 7 to 9 year mark, right, where they've been on the job long enough. They probably have some experiences. They've been running different shifts.
Their hips and back are messed up.
A ton of different, you know, calls that they've been out to, things that have happened to them, training events, and they start to have things like that happen around that time frame.
And so I think it's perfect timing that now, again, it says treatment is optional, but man, you talk about preservation of force, because this is what happens is guys will do the job excellently, talking about the guy we're talking about, and then his life starts to degrade outside of the job.
Preservation of force.
Yeah.
Right? The force being the entity, okay, is comprised of what?
The individuals.
Multiple individuals.
Multiple individuals.
So we need to help find, fix, finish the individual.
And so what we start to see happening is they start to kind of fall apart in their own life, making bad decisions, marriages, infidelity, drugs, drinking, whatever it is, to escape, to self-medicate. And then that obviously that's going to flow into their professional career. So here these guys are serving 10 plus years. They're heroes, in my opinion, right? And then because of in the past, because and still right now, this is still being, you know, this is just all very new information. They fall apart, and now basically they make bad decisions that can be traced back, that we know can be traced back to hormone deficiencies, not being healthy and optimal, because your stress is through the roof, your sleep has been shit, your nutrition's been shit, you know, and you've been doing this high impact, high adrenaline job for so long that things start to degrade, and then we ruin people's lives over it. I mean, or the worst case scenario, we lose guys. Yeah.
And again, we're going back a little bit in time, but just think about the conceptual aspect to this of a lot of our guys were getting out at about that 12-year mark.
You and me both.
So we had 12 guys who've been in for 12 years, X amount of years in special operations, X amount of deployments, which those things don't stand on their own leg, right? It's the information, the knowledge, like everything that this man has that he can continue to pass down to himself, refine himself, become better himself, pass down to other people. What's happening is the guys were getting, you know, stressed and everything you just talked about, unsure of what to do, and they're just like, fuck it. Either I'm out or I'm getting kicked out. So now we're trying to do like a remove and replace. So we're going to take a guy who's been in for 12 years, remove him because something's wrong. We're just not looking for it.
Right.
We're going to try to replace him with someone who's been doing the job for 6 months or a year. It's not an effective way for the system.
When you can take care of the guy, make him optimized, you can get another 10 years out of him.
Exactly. And think about
he can operate until he's 40.
How much more refined that individual is going to be, how much more the legacy he can begin to leave upon all those people.
But instead, what do we see? Like we saw with Cody too. Like they will start pushing SSRIs in the system, like while you're in.
Trying to put a Band-Aid on a sunken chest wound, man.
Right.
I mean,
it's not gonna work. It's only gonna make things worse. And then that transpires. So now guys make a decision. Either they get out their own, or like you said, they get kicked out because of bad decisions that they made. And then we check into now we're on the VA side of things, and we check into the VA, and bro, I mean, you know as well as I do, it's like, let's see, I wrote it down what I had: Ambien, Prozicin, Zoloft, Adderall, Tramadol, all in one kit. Here you go. Here's your thing to go to sleep. Here's your thing to adrenal blockers to keep you from having bad dreams, which is an adrenal blocker, so you're suppressing adrenaline. Zoloft for your depression, which makes you more depressed somehow. Adderall to wake you up in the morning because you're drugged out of your mind all night. And then, but your body hurts? We got Tramadol for that.
Basically like the Hunter S. Thompson.
Yeah.
that
Right.
quote that he's got, where
Yeah.
like uppers, downers, speeders, lowers.
Yeah.
Like,
all in one goodie bag, you know. Anyways, and then of course you ask about testosterone, and initially there, and still to this day, we had a guy in the Agoge, Todd.
Yeah.
He messaged me. He's like, he asked to get his testosterone checked, and he's like, oh, we'll check it. And the doc straight up said, we are not. What did he say? I'm just gonna pull it up verbatim.
you go for it. He messaged me as well. But if you got
Did
a
he?
verbatim, go ahead. Yeah.
Yeah. I was just funny. I was like, well, what did you expect, homie? I want to see who this doctor was. Went to the VA today for a regular 6-month checkup. Asked if I could get my testosterone checked. The doctor looked at me and said, yes, but I can't treat you for low testosterone.
So we can check it. You may or may not find out that you are deficient in need and actually, suffering, unfortunately, from some sort of the side effects. However, if we know this, we cannot aid or assist you.
That's the VA. So this whole process has been working because we've been working with the VA. Because, listen, I know we bash the VA a lot, and I'm a veteran. I just had my annual with my new primary care because I fired my former primary care because he was basically not doing anything. He was sold on giving me tramadol and SSRIs. He wanted me to come off testosterone and get on medication because testosterone was going to kill me. I'm like, no, bro. The pills that you prescribed to me when I got out of the Marine Corps almost killed me. I almost went to respiratory arrest, and I was depressed. Like I almost committed suicide. Like I'm good, bro. Like this, I'm running real good right now.
If you're seeing or listening to me.
Yeah. So I remember looking at him and going, yeah, you are not somebody that I would take. He looked like the aliens in the coffee room from Men in Black. Like,
yeah. I had to think
you
about
throw that up
where
on,
you're going.
you know, like the really skinny, but the belly and
yeah.
everything. And then he had like 47 mask on and a face shield. And I'm like, gloves. I'm like, listen, this is not an awesome, representation of health and optimization. So I'm going to find a different doctor. That took me 2 years. But I just saw her. She's a freaking gangster, and already helping me out. But unfortunately, so then you go from active duty to VA, you check in, and then they're not doing anything either. And then they do, like what they're saying, you're using data from 1985. And like, we got to test you to make sure you're low, and then we got to test you again to make sure you're low, and then they just keep kicking down the can. And if they do prescribe a protocol, it's a low dose of testosterone over a long period of time, which we know the half-life of testosterone cypionate is about 3 or 4 days.
3.5 days.
Yeah. And so like you feel good that third or fourth day, and then you start tanking.
Ride that roller coaster right there.
They're not managing estrogen. So if a guy is a estrogen converter, they're not managing that. They're not looking at that. They don't look at sex hormone binding globulin. And on that pill, if you watch the whole video of the thing, they don't test your PSA. And that floored him too. And he was like, you guys don't even test PSA.
I don't know if they're aware of maybe what that is, though.
Hence the problem.
I mean, like, I'm not trying to give them an out.
Yeah.
Right? But, like, legitimately, if they're not even schooled up and spun up on the knowledge and the information that they should have, that is within their profession,
Yeah.
then they're not going to have answers for it. The ones that they do have, you're not going to be able to talk to them.
Talk to me about, like, when you got out, and obviously you got out and had your injury.
Yeah.
And then when did you first get on, and what was the change? Was that with me, with Dr. B? Is that what we did?
I mean, it was with Dr. B.
Yeah.
Let's put it this way. I was advised
Yeah.
by someone sitting across from the table from me, right? That was already on like the research side of the house of trying to figure out what things were, right? There was like, you had gotten out earlier than me.
Yeah.
And it wasn't just me. There was a multitude of other people.
Yeah.
You were like trying to find that information and push it down the pipeline. Like I remember it was like one of the first things I think that you were like, dude, listen,
This
have
is
to
the
listen
fucking
to me
game
on this.
changer. Yeah.
And it was like not my unwillingness to think that you were wrong.
Yeah.
It was just so new to me and, trying to figure it out. And that was the one
And we were
thing.
young. For
Yeah.
all intents and purposes, we were young.
Yeah. So I had just come off an injury. So I'm like, I'll figure this out. I'm going to be able to bounce back because I was incapacitated for, a duration or period of time, not my normal physical self. And I'm like, well, I can figure this out.
How long were you down? Like really down? over a year.
Over a year.
Yeah.
Yeah, over a year. I mean, it was almost 2 years to the day or somewhere in that time that I had gotten out. And I don't know if I was ever really like 100% full, but I was good after, you know, a year. I had a bunch of other surgeries.
You were back to training and
yeah.
Yeah.
So exactly what year? It was quickly soon after. And thank God that it was. And my stubbornness, uneducation, ego, you know, whatever you want to call it. Like, I thought again for a while that I was like, all right, I'm going to be able to fix this. I'm going to be able to finish this. I'm going to be able to figure out what it is. I'm going to be able to rectify it. Just as I had my own physical body. But the physical body, I was able to, like, you know, lift weights or do band work or do some recovery work or have a profession come in and do massage therapy or whatever the thing was. So I was able to fix that. I was like, well, if I can fix that, it's just going to be a little bit, you know, like my internal system's going to catch up. Unfortunately, that's not the case with this. Like, it just doesn't rapidly heal itself when you've had so much trauma or injury and things like that have happened. So from being, I say who I was, right, prior to injury, like capabilities, like cognition, like things I was able to do, and then, you know, you get knocked down, and then there's a period of time I thought I could just recover, be better from it. And then there was a window where it's like, I guess this is just my new norm.
You start accepting things.
You start accepting it.
Yeah.
I'm a stubborn asshole.
Yeah.
Like I'm stubborn, but for some reason, that portion of it, I just accepted that this is as far as I can get my body to be.
I'm getting older. I got injured.
This is just where I'm at.
This is the new norm.
This is the new norm.
Oh.
And once that creeps into your mentality, that's even a possibility.
This is full acceptance.
And you're accepting it.
Yeah.
And then once you accept, I think that level, there's a reluctancy as well to either listen or to the information from knowledgeable professionals that this is their industry.
Yeah.
Like, it's not like in the industry for money-making purposes. That's a byproduct. All businesses make money.
Sure.
It's an industry to help human beings, to get them to the most
This is your zone of genius.
on an individual aspect as humanly possible. So why not turn ourselves over to people like that are capable of doing so? And if we don't, why? There's got to be a reason why. Like, and that's the thing that I don't think we ever get answered. Right? It's not a lack of information anymore at this point. We can't say that.
Were you on? You were not on when you were in Hilo. That was the dark time for you when you were up in the north side.
Nope.
And that's when you were pushing through.
Yeah.
That was a dark.
Literally pushing through.
That was a dark time.
Yeah.
And then right around that, towards the tail end of that, is when you started, right?
Yeah. So it might have been a year and a half after I got out. I'll use that as a rough number, somewhere in that realm.
But after your time in Hilo, yeah.
Yep. Finally got back on, you know, I say got back on everything and get back on everything. Like, I found myself again.
Yeah.
Like, I went to a doctor, right? They ran their tests. I got a prescription. I adhered to the prescription.
Do you remember what your test was when your first test?
In the twos.
In the twos?
I always want to say like 246, 247.
How old were you?
32.
So about the same as me.
Yeah.
Yeah. Wow.
And then I dropped my ego, right, and said, okay, if I really want to figure out what's going on here, I need to turn it over and just go get some tests done. Like, that was the biggest thing, go get a test done. And I remember you saying, and this is what I tell people now, is you're going to get one of two answers, and they're both going to be amazing. One is going to be, well, sorry, buddy, like, your test is low. However, guess what? We can help you, rectify it by these measures.
Right.
That's an awesome answer. An issue, I have a problem, I have a deficiency, but someone can step in and help it properly, that's a win. Or I'm going to get an answer of, hey man, you're good. Like, your numbers look great.
Yeah.
Like, your testosterone looks great, maybe a vitamin here or there, or maybe another link along that chain of lineage. But at any rate, you know. So whether you need it or whether you don't, you now have the proper information to be able to move forward.
One thing I want to highlight though is like you can't just do a CBC metabolic panel and test your total test. Like, that's not a blood panel. And I think that's where a lot of people, like, if I've seen VA paperwork or regular GP paperwork for doctors, and that's all they're testing. And they're not testing the stuff that Sydney was talking about in Capitol Hill.
Where else in the human body do we do that? Like, that's probably a deeper rabbit hole to figure out.
Yeah. Well, like he said, you wouldn't test like that for cancer and prescribe medication.
No.
You wouldn't test one biomarker and be like, okay, you're going to go on chemo. No, you're testing everything. So why is it any different?
Fullest answer is humanly possible.
Yeah. So a big picture thing, this is like, I'm stoked that this is happening. One, I think it is going to be a massive preservation of force for the federal government, or for the Department of War. And then also, as it transfers into the VA, which is looking very, very good, I think that we will save an enormous amount of lives. If you look at veteran suicide and you test their testosterone, almost every single one of them are suffering from a hormonal imbalance. And I mean, I know you, same as you, same as me, I was like depressed before. How many guys were straight up just depressed, and then all of a sudden you get your hormones worked out, and you're like, I'm not fucking depressed at all.
It's like you're in the clouds for a while, and like, this isn't right. I shouldn't be here, but
Right.
I really don't know what to do. And then you get it tested, if need be, right? Get your protocol, take, a little bit of time for everything to check in. And then it's like you punch through the clouds, you lift above the fog, and everything is a little bit clearer at that point.
So that was again, you guys, I'm going off the data that you guys have shared, the ones that took that survey. I'm going off the experiences of the patients that I've worked with in CORE, and myself, and my own story of how I felt pre, and then what my quality of life was like, and then what my quality of life was like after. It's drastically different. So at the end of the day, if you guys is anybody out there is over 30, and you don't feel like you are who you are, or operating, like you said, you've adjusted to a new normal. Yeah, fuck all that, dude. I want to be optimal all the way to the end. I want to be the best version of myself that I can be all the way to the end. And it starts with getting a blood panel, and the link's below for that. And that's it. And there's no, and like what you said, there's no commitment. Like, you're not committing to anything other than a blood work.
No,
I think
the one thing you do is get a blood work every 6 months or a year.
Yeah, absolutely.
Keep those dots, those timeline dots, like we were talking about.
That's right. So anyways, if you're on that plan, if you're at the VA and you're on SSRIs, I suggest pushing them to do a full 28 panel blood test, or get with us and do it, and then invoice them. Actually, I think TRICARE will pay for your blood work. So then you're out of nothing. If you're a vet or you have insurance, your insurance will take care of your blood work. So you're out of nothing. Now you have the full picture, and then you can make an educated decision on what you want to do. So, well, honestly, like, I'm stoked for all the guys that went to Capitol Hill, and the fact that Pete made that video, I think it was like 30 minutes after that conversation on Capitol Hill. I was like, this is 10 years of working on this, and we're finally starting to knock down doors. It's amazing.
I think this is one thing too. Like, if you're looking at, like anything else, if you're looking at the topical side of it, you're going to hear people bitch, moan, and complain. You're going to hear people, shouting and rooting for it. Do a deeper dive and actually spend a half hour, spend an hour to watch like some videos and actually get educated on what's happening and what's going on.
Hey guys, thanks for watching. I really appreciate that. Remember to like it. Remember to drop me a comment. I want to respond to it. I'm actually the one responding to the comments. And if you like this video, you're going to absolutely love this one right here.